So today we're going to talk about coronavirus, what the treatments are available and what does the future hold. So let's take a look at the current global situation as of the 5th of March. Total confirmed global cases are now reaching 100,000. We can see that it's a truly global issue with confirmed cases in almost 100 countries. The highest reported numbers outside of China are now in some of the major European countries, the USA and Iran. Looking closer at the figures, we can see an unusually small number of cases reported in Hong Kong, Shanghai and Beijing. These are some of the most densely populated regions in China, with over 60 million people within these cities. But less than 1,000 cases have been reported. So it's more than likely that the cases in China have been massively underreported and unrecognised. Similarly, this is likely to be the picture globally. We can see the case numbers are high in the more developed countries. However, countries with poorer healthcare systems simply do not have the capabilities and capacity to adequately identify and test for this virus. We can see even that the USA have reported massive limitations in the numbers of their own testing kits, and here in the UK the system is slow and ill-prepared to test large numbers of the population. This, together with the fact that so many cases, around 80 to 90%, are mild in presentation, the reality is likely that the number of infected are at least double what is being reported, and possibly even as much as 5 times. The numbers could well reach over the million mark in the coming weeks. However, having said this, we can be relatively certain of the death rate, especially in the more developed countries where reporting is strict and well documented. The UK has had 1 death so far, and the USA have reported 9. These figures of course represent a lag, as the course of the illness can take weeks before causing death in those who are elderly and with other comorbidities. Nonetheless, we are looking at a death rate somewhere below 5%, probably as low as 1 to 2% with good healthcare systems and treatments in place. Now this is reassuring, as the proportion of deaths is quite low. However, if we project the overall caseload as 1 million infected people, we could be looking at up to 50,000 deaths globally. Perhaps the more worrying aspect of this is the knock-on effect on the overall healthcare systems of countries. What happens when the doctors and nurses have to isolate themselves, and clinics and hospitals are stretched to breaking point? Already countries are considering pausing all non-urgent healthcare and drawing up plans to draft in retired doctors and even medical students as part of an emergency workforce. Undoubtedly, we will see an increase in mortality from other conditions, as simply the healthcare will not be available. This in itself could represent deaths in the thousands. So, with all of these concerns and no real signs of the infection slowing or abating, what treatment options are there, and is there anything being developed to combat the coronavirus? Fundamentally, the WHO plan is to interrupt the spread by early identification and strict isolation measures. However, this is proving very challenging, as this virus has a long incubation period and seems to be highly infectious even before patients are becoming symptomatic. But in the bluntest of terms, there is no treatment to combat coronavirus as of yet. The good news? Well, 80 to 90% of cases will self-resolve with simple at-home measures. This includes good hydration, rest, antipyrexual medications for fevers, just as if you had a common cold or a bout of flu. The remaining percentage may require hospitalisation, as there are several clinical syndromes that can result from the infection. The most common being a viral pneumonia. This is in essence when the virus attacks the lungs and there is a direct impact on breathing. So shortness of breath, severe cough, low oxygen levels, etc. Pneumonia is common and often recoverable. However, as the virus itself cannot be treated, this can therefore progress to something called acute respiratory distress syndrome, ARDS. This is a type of lung failure. Now, this can be fatal, and patients will require assistance with breathing through oxygenation and even assisted ventilation. Sepsis and septic shock are other sequelae of any infection, including the coronavirus, and this is where the infection travels through the bloodstream, creating a system-wide inflammatory response syndrome, leading to multi-organ failure and potentially death. Now, the real challenge is the lack of treatments available to combat the virus itself. Hospitals are therefore left with focusing on supportive management. This is through oxygenation, fluid resuscitation, assisted ventilation, and giving empirical antimicrobial therapy for any possible secondary infections. Currently, there are hundreds of trials looking for some kind of effective treatment against coronavirus. Amongst the frontrunners is a drug called remdesivir, developed by Gilead. This drug is known as a nucleotide analogue and is meant to help block viral replication in human cells. It has been shown to have efficacy against MERS and SARS, both of which are types of coronavirus. Clinical trials are underway across several countries, and some study results should be available in April. Gilead's stocks have risen sharply by around 15% in the past month, with the hope of this treatment being effective, and this being in a time where the rest of the global economy has slowed down. Vaccines are also in development, and whilst some are reaching trial stage with animals and some even reaching trial stage with human testing, we are still looking at them being many months away from completion, and possibly even longer before they're available to the masses. It is difficult at this point to predict what happens next, but we are likely to see a further spread in the coming 2 to 3 months before it hopefully starts to slow down. At this point, there will be some treatment options available, but as to how effective they are, we are yet to see. But there is unlikely to be any curative or preventative vaccine for quite some time. So many thanks for listening. I hope you found this helpful and interesting. Please subscribe and keep an eye out for any future videos. I'll certainly be doing some updates on coronavirus in the coming weeks and months.